This is a case of spastic hemiplegia pronounced on the right. Right arm is especially affected. A yellow arrow would help you to highlight the abnormal performance of the right arm on this video. At 5 years of age, this child already had 4 years of physical therapy. However, her right arm is still rigidly bent, spastic, and very much non-functional. You can see this girl moves her left arm normally, but her right arm, she cannot extend it properly. Her hand and fingers always stay closed, her elbow stays bent. It is also possible to see that her right leg is far from healthy. She bears her weight on the left leg mostly. Her right leg habitually rotates inwards, and she easily trips and loses balance. When she kneels, her right foot is turned inwards, and when she tries to move backwards, it is obviously difficult for her to move the right leg. It is quite obvious that the child does not want to be assessed and tries to escape. However, even in these circumstances, right arm is of little use to the child. Her hand stays collapsed. Please focus on the position of her shoulder blade. It is clearly shifted sideways, being the true main cause behind the deficiency of her hand. The shoulder joint is very weak, causing this awkward position of her arm. Closer zoom reveals a standard combination of factors that ABR sees as fundamental causes of hand dysfunction. Her shoulder is protracted and rotated forwards, her neck is weak and bulging, her upper thorax is weak and depressed. ABR addresses these structures first. In the beginning of our rehabilitation program, we do not even touch the arms and hands themselves. For the parents of quadriplegic, severely affected children, this case might look too easy. However, we would like to put the emphasis on the fact that hemiplegia is also a result of brain injury, as the quadriplegia, spasticity, muscular imbalance, joint deformity as pronounced as they are in case of quadriplegic child, although on one side only. I would also remind that this child had 4 years of physical therapy. However, her hand remained spastic. The following zoom clearly shows that. We see this girl a year and a half later after 1,000 hours of ABR. There is little to comment here because the spasticity has gone and mobility of her arm recovered almost completely. Please note that this breakthrough at her arm function is based on standard ABR foundation, recovery of chest volume and strength, normal alignment and strength of her neck. Please watch this very attentively. This is the way the normal respiratory function looks like. This is the proportion and volume of the chest and neck that is necessary for normal arm and hand function. If you want your child to have as good of a function as this girl, this is the foundation that has to be built. Everything is very straightforward. No structural foundation, no function. Structural foundation guarantees function. And the good news are, it is always achievable. Sometimes it is more work, sometimes less, but this could be done even for severe quadriplegic children. Sometimes we are asked if ABR is only good for severe children. Obviously, if ABR is efficient for severe cases, it is even more effective for mild and moderate ones. This child is a good example. You see, she gets this, yeah? She starts getting the involvement another ABR a year, and you would never see a sign of a handicap in this group.